Are you aware of the long-term breastfeed benefits for you and your baby? Should you breast or bottle or both to feed your newborn baby? Now that's the big question. There's only really two options, but a very small window of opportunity, so watch to the end to find out why. I will first show you an extensive list of benefits so you can make a responsible decision that suits your specific needs. You can only fear that which you don't understand thoroughly, so don't worry. We are here to support you every step of the way. Once you're in on this path, I'm there for you. I'm Dr. Chris, MD. I'm helping mums to be happy and raise happy, healthy babies. So as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So breastfeeding is natural, but it doesn't come naturally. It takes some effort. So any amount of breastfeeding is good for your baby and for you. It's free, nourishing, convenient, protects, and your body makes it especially for your baby.
I used to think that breastfeeding was just another thing you had to do to keep your baby alive, just another everyday task. But now that I've been doing it for a few months, I've realized that it's a way more deep spiritual experience, especially when they're laying there locking eyes with you, stroking your hand with their little fingers. It's definitely a very special bonding time with you and the baby.
So benefits of breastfeeding for your baby. Okay, the short term, here's a lot of stuff, but pay attention. Bonding, closeness and comfort, especially through the skin-to-skin contact with mum. So baby feels safe in mother's arms. It gets used to the scent and smell of mum, so to find the breast again, they kind of do the crawl, like little puppy dogs come when they seek the crawl in the breast, because there's no hands to help them. So there's attachment to mum. It keeps the babies happy, and that helps a lot. Babies cry less. They sleep longer naps if they're breastfed. They get a good balance of nutrients. It promotes healthy baby weight and also healthy growth. It's easy to digest and even contains enzymes to help the digestion. There's probiotics that get planted in the baby's gut, so now they have less stomach problems. It contains live cells also from the mum's breast inside the milk, which boosts the baby. There's disease-fighting properties in breast milk. It protects against illness, less bacterial infections likely. They don't vomit as much or hardly ever, less diarrhea. And rarely do they have allergies and a lower chance of developing allergies to foods and plants and animal stuff as well. So less chance of SIDS in the first year. We're all scared of sudden infant death syndrome. It's rare, but this way protects you vastly against that, or a better chance. Now it also boosts your immunity of the baby because the antibodies are supplied through the breast milk. It enhances social and emotional development. And they're also, funny enough, strange enough, but a good thing, they develop higher IQs if they're breastfed. That's an amazing discovery. Now the long-term preventions for the baby is ear and respiratory infections in the first year. Just don't happen easily when they're breastfed. They don't get obesity easily. No, not likely to get asthma, or less likely. They're less likely to get atopic dermatitis or these funny little eczematous skin rashes. Later in life, they would not get hypertension as easy, or high cholesterol, or even diabetes in later life. They're sort of protected against it by being breastfed. Now, also cardiovascular disease and heart attacks are much less likely to occur if they were breastfed as a baby. Now, endometriosis, that heavy, painful period, and the infertility when they're grown-ups, like to young adult females, this will also be abated. Certain cancers like leukemia will be lessened the chances. Rheumatoid arthritis, lupus, and other autoimmune disease not likely to happen if they're breastfed. Okay, please subscribe and click like if you like the video. I would appreciate that. Now, benefits of breastfeeding for mum. Check this out. The short term, it's one of those special mum things, of course. That's the bonus. It's a natural solution. It makes mums relax. They enjoy their baby. There's also this feeling of love that is cultivated between mum and baby. It's an increased confidence and self-esteem of the mother. It's natural and convenient. It's the correct temperature, so there's no heating required. There's no sterilizing or preparing a formula, which can be a schlep. It's free. You save money. Now, the formula can cost a few $1,000s in the first year if you only formula feed your baby. Go make the math. Emotional satisfaction and fulfillment for mum. Strong bonding and closer relationship with baby. In close contact with the baby, of course, their mother catches things sooner. If anything would go wrong, they would notice it on the baby. Okay, less postpartum or after the birth, hemorrhages or bleeding vaginally. Breastfeeding hormones help also faster shrinking back of the uterus. We call that involution because the uterus is pretty big after the pregnancy and it has to shrink back to normal size. It's also family planning. It's a natural form of birth control to be breastfeeding. So it saves mum a lot of time. This is cool because especially in the middle of the night you have more time for yourself. Now here is the long-term benefits for mum breastfeeding. It restores mum's body. It returns to the pre-pregnancy weight much quicker and lose that weight that you've gained in pregnancy. You have less menstrual bleeds. You have less chance of anemia or lack of blood. There's a lower rate of postpartum depression, which they call the blues, or some women tend to get depression after giving birth. And this is lowered from breastfeeding. It also decreases unintended next pregnancy, so you don't fall pregnancy lightly when you're breastfeeding. Mums miss less work because their babies are healthier. There's less of a chance of obesity for you in later years. There's also less of an osteoporosis chance when you get older. That's when your bones get thin, when you pass the menopause. There's a decreased rate of breast cancer, ovarian cancer, and uterus cancer. Now there's also a little bonus is there's also benefits for the family. It's cost savings, so now there's more money for other things for the family. It's also more time for each other and for the other kids because you're occupied, when you breastfeed. It's quick and easy. Good family planning method, and there's the natural birth control. It's the good healthy baby because it's wealth of your nation. Remember that. Formula, let's quickly say a word about formula. It's not always possible to breastfeed for many reasons. So formula is made like one mix for all. It's not a competitor of breast milk, but it's a substitute for breast. Now, 90% of mums want to breastfeed at birth, according to surveys in the US. And at 6 months, only 16% still nursing. Okay, babies also thrive on formula, just like on breast milk. That's okay. It also keeps the baby happy and convenient to feed at any time, and it's easier to schedule, and it's very flexible. So mum does not have to be present. She can take a break as the dad or the babysitter or the daycare can also do this, do the bottle feed. Now, mum can follow any diet of her own and don't have to eliminate any things that can cause colic in the baby. Mum does not have to be dealing with the breast problems, which is rare, but it can be a nuisance. And it's said to be safe and healthy, like it's been around since 1920, the bottled milk. Whichever way you choose to feed your baby, breast milk, formula, or a combination of both by supplementing, the most important thing is that your baby is well fed, well cared for, and loved. So ditch the mummy guilt idea thing, not necessary here. If you don't initiate breastfeeding immediately after birth, your milk just dries up in just a few days and you've missed the opportunity forever. So remember that when you give it a challenge and a trial. How is breastfeeding going for you and your little one? I'd like to know. Do you have any challenges? Do you like breastfeeding? Please comment below and I'll make more videos. Just tell me what you'd like to hear. This is Dr. Chris signing off. Ciao.